So primary diagnose is first of all is done twice during inspection or during presentation of a case, and basically what happened is that it is done after subjective inspection and after objective inspection. So what basically happened is that you make up a diagnose regarding what the patient tells and what you can see regarding general inspection, but without doing further investigation. So primary diagnosis is basically pathologies that, according what you see and what patients tell you, that could possibly be. And from that, you start asking more questions and looking for specific signs to appropriate into the types of pathology you possibly think that the patient could have. So for this video, I'll be doing primary diagnosis of the case and final diagnosis of the case of a patient that I did in case history. So the patient came into the hospital complaining in subjective examination of pains in the right side of the chest, dyspnea during inspiration as well when he's at rest, paroxysmal cough, which means that the patient is coughing very hard. The patient also has very few sputum tracts but with a little bit of blood. The patient presents subfebrile temperature, a general malaise, and tiredness. The associated complaints that the patient also presents is difficulty in sleeping because of the cough, difficulty during exercises because of the tiredness that he feels, absence of appetite, and loss of weight in the last 5 months. So after hearing all these complaints about the patient, we make up a primary diagnosis. And in this case, the primary diagnosis that I made are possibly a tumor or right heart failure. And in right heart failure, there are a few pathologies that we could be thinking about, which is pulmonary embolism, chronic obstruction of the right side of the heart, chronic obstructive pulmonary disease, which is COPD, minor coronary artery diseases could be possibly a cause as well. So this is primary diagnosis based on of the subjective inspection. Then objective inspection is done. And after objective inspection is done, we notice that there is impairments in the respiratory system and cardiovascular system. There are no impairments besides normally tachycardia, which could be caused by many other problems besides cardiovascular, possibly nervousness, for example, or tiredness because the patient reported not sleeping well. Then we did examination of DIT, and the patient also did not present any dysfunction. And the main idea of the local study that presents problem is respiratory system. So after doing the objective inspection, we again do a primary diagnosis. And in this primary diagnosis, after objective inspection, again we could have tumor or right heart failure, which could be pulmonary embolism, chronic obstructive pulmonary disease, which is COPD, or minor coronary artery diseases. However, to make sure and do a final diagnosis, we need further investigation. To do final diagnosis, it means that we did further investigation and we'll plan the treatment according to this final diagnosis, which means that you understand the pathology that the patient has and you also understand what are the circumstances in which the patient is and what the patient needs to be treated according to that pathology. So for that, we usually do further investigations. We can do instrumental tests or laboratory tests. In the case of the patient, we did laboratory and instrumental tests. For laboratory, we did complete blood test, blood chemistry, and other checks to check general health of the patient and in case the patient needed surgery, for example. So we did COVID test, HIV test, hepatitis test, HCG, which is to check for pregnancy because the patient was a female, and then we did a sputum analysis. After that, we did instrumental examinations. We did X-ray, computer tomography, and MRI, ECG, and bronchoscopy to check for the general health of the patient, respiratory system, and cardiovascular system to check any abnormalities. And after that, we can do a final diagnosis. So the conclusion and final diagnosis of this case for the patient is that the patient presents lung tumor mass in the lower lobe of the right lung. The classification is T3M0, which is large in size, but no metastases have been identified. So that's how we do a primary diagnosis, and then we do a final diagnosis for the patient. And based on that diagnosis, now we can plan treatment for that patient who presents a tumor.